Hello, I'm Dr. Patrick Hu, CEO of Moffitt Cancer Center. We're here in Chicago at ASCO 2024, and I'm privileged to be here with Dr. Fred Locke, who is head of our bone marrow transplant unit and a cell therapy expert. So, Fred, thanks so much for being here with us.
Absolutely, Patrick. Glad to be here. Always enjoy coming to Chicago for ASCO. And as a cell therapist, really excited to see all the things happening in the field. There's a number of abstracts presenting data on cell therapies for solid tumors. Claudin 18.2 is one of those targets, and we're starting to see responses in solid tumors with adoptive cell therapy. We have approval for TIL, and we have bispecifics. It's just a really exciting time to be in the cell therapy and immunotherapy space for cancer.
Wonderful, because previously we had a lot of CAR T approvals for lymphoma and myeloma. You led a lot of those yourself, and now finally it's starting to come over to solid tumors when some CAR Ts and the TIL approval. Then there's this area of bispecifics, right? Because that is, tell us what a bispecific is, and is it working for solid tumors?
Yeah, absolutely. A bispecific T-cell engager is quite simply attaching to the T-cell and attaching to a target on the surface of the tumor cell, and that causes the T-cell to activate and kill the tumor cells. So it's not a true adoptive cell therapy, but it works in a very similar fashion, bringing the T-cells to the tumor. And we now have an FDA-approved, recently FDA-approved bispecific for small cell lung cancer called tarlatamab. And as you know, at Moffitt, we were the first to administer this after FDA approval. And so we're working to leverage our expertise in the cell therapy space and in the bispecific space to create a platform so that patients with any tumor type can get these therapies safely and effectively.
So why should a cell therapy unit also treat patients with bispecifics?
So these therapies have a risk for immune-related adverse events, which are different than immune checkpoint blockade. It's cytokine release syndrome, and this can be high fever. Sometimes even patients can need a ventilatory support. So we need to watch them carefully to avoid those complications. So we have that expertise, and so we have sort of an onboarding process so that we can treat those patients very rapidly and safely, and then they can go back out and continue to get their further down the road infusions where the risks of those toxicities are much lower.
Well, thanks so much. Dr. Fred Locke here with us today, internationally recognized cell therapy expert. Thank you for being with us.
All right. Thanks, Patrick.